Good evening from Boston College. My name is Brian Garreau. I am the Associate Dean for the Core Curriculum at BC and Associate Professor of Sociology and International Studies. It is my pleasure to welcome you to the Show at 6, BC and the Common Good. The Show at 6 features friends and members of the BC community discussing a range of issues affecting our world today, all revolving around the theme of the common good. Topics include how the BC community is responding to the effects of COVID-19, to the enduring challenges of the marginalized, to our own resiliency and solidarity, and to the upbuilding of human dignity throughout the world. The show is based on the central insight of the common good. That is, that the resources that humanity has and needs must be shared equitably, and that each of us has an obligation to promote the common good. In the age of COVID-19, pursuing the common good means social distancing, wearing masks in public, and washing our hands frequently. These practices, like other forms of solidarity, are not only for your own good, but for the common good, for the good of everyone. Now, our show this evening is titled Nurses and EMTs, Treating COVID-19 Patients. My co-host this evening is Professor Joyce Edmonds. Joyce K. Edmonds, PhD, MPH, RN, is an associate professor at Boston College in the Cornell School of Nursing. She received her MPH from Oregon Health Sciences University and a PhD from Emory University. She has over 15 years experience in nursing and public health practice and research focused on maternal health outcomes. Dr. Edmonds leads the Nursing Insight portfolio with the Delivery Decisions Initiative team at Ariadne Labs. At BC, she teaches population health nursing and introduction to public health in a global society as part of the new public health minor. She is currently chair-elect of the American Public Health Association's nursing section. Welcome, Joyce. Now, before getting started, let me explain how you, the audience, can get involved in the conversation. At 6:40, Dr. Edmonds will begin asking our guests questions from the audience. Members of the audience can pose a question before 6:40 via the Q&A button at the bottom of your Zoom screen. So let me say that again. You can pose a question before 6:40 via the Q&A button at the bottom of your screen. Now, when you're posting a question, please identify yourself by name and your relationship to Boston College. And with that, let me turn it over to Dr. Edmonds to introduce our guest this evening.
Thank you, Brian. I'm so honored to introduce our guests who I've had the pleasure of teaching in the classroom during their studies at BC. We'll start with Aristotle Boslet, who graduated from Boston College in 2018 and is an ICU nurse at Mount Auburn in Cambridge, and also works per diem at Beth Israel Deaconess in Longwood. As an undergraduate at Boston College, Cornell School of Nursing, Aristotle kept busy as a research fellow under faculty working to publish qualitative research on palliative care in the ICU. He was also part of an outreach team that provided health services to marginalized communities in the Dominican Republic. Currently, Aristotle is involved in direct patient care with acute cases of COVID-19. In the near future, he is interested in pursuing graduate education in nursing anesthesia. So welcome, Aristotle.
Thanks for having me.
Next, I'd like to introduce Gianna Cansemi, who, congratulations, graduated recently in May from Boston College with a BS in biology. And she also, I might add, completed the 3-course public health concentration, which is now developed into our new public health minor. For the past year and a half, she has worked as an emergency medical technician in Boston with Armstrong Ambulance Service. Gianna hopes to become a physician's assistant in the future. The incredible resilience, hard work, and hope demonstrated by healthcare providers and her fellow EMTs has solidified that goal. Welcome, Gianna.
Thank you so much for having me.
Next, we have Addie Agan, who is a 2018 graduate of BC and is an emergency room nurse at New York Presbyterian Hospital. At BC, Addie was involved with 4 Boston at Perkins, Healthcare for the Homeless, APA. She studied abroad in Manila and was a Jamaica Magis leader. She was also an undergraduate research fellow for me, I might add. In addition to her work in the ER, Addie has been capturing the experience of the pandemic through her photography as a way to help uplift her colleagues. Her collection, entitled Faces of the Front Lines, gives us an inspiring glimpse into the heart of the emergency room. Welcome, Addie. And finally, we have Catherine McQuaid, who is a 2015 graduate of the Cannell School of Nursing at Boston College. She graduated summa cum laude and was a member of Alpha Sigma Nu and Sigma Theta Tau Honor Societies. She received the Sigma Theta Tau Excellence in Clinical Practice Award, and as an undergraduate, she was a peer mentor in the freshman nursing seminar. She has continued her passion for mentorship, serving as an alumni mentor to undergraduate nursing students. Catherine began her nursing career as a staff nurse on the inpatient cardiology unit at Boston Children's Hospital. And since 2017, she transitioned to a role as a cardiac ICU nurse at Boston Children's. And currently, congratulations, Catherine, she's continuing her education in the nurse anesthesia program at Columbia University. So welcome all of you. It's great to see you.
Thank you.
Now, Professor Edmonds is the real expert, so we're certainly going to let her ask the majority of the questions tonight, but I couldn't help but ask the first question just as a co-host. And it's a simple question, but I think it's a very important one. And the question is, how are you? With Memorial Day just celebrated the other day, and I personally have family who have served in the armed forces and currently are, I still can't help but think of the health workers who have sacrificed so much to keep us safe. And I wish to honor them as well, as I have this weekend. In an April BC news story that I read again recently on the Cannell faculty involved in clinical practice, it was said that, quote, the most striking commonality is the pride and unwavering commitment they have to serve as a nurse during the most pressing public health emergency in 100 years. Now, I think that so much of what we're doing around the show at 6 is embodied in your very work choice. You truly embody the common good in everything that you do. Our hearts go out to you. We're proud of you. We salute you for the work that you are doing and will continue to do to keep us all safe. But I must ask as a first question, how are you? How are you coping? And maybe we can start with Catherine to answer this question.
Hi, thank you. Thank you for having me as well. So personally, I started at Boston College and I felt that it was a moral and a social obligation and a calling that I had to use my Boston College education to care for children and their families during the most vulnerable times in their lives. I think that being a nurse during the COVID pandemic is really a continuation of that passion and an extension of that responsibility that I feel to pursue the common good. I think during this, my biggest fears have been what a lot of other people share, which is a fear myself of getting sick, a fear of spreading this to other people, and mostly a fear for my patients and what this virus means and the outcomes that they will have. Luckily, I have a really, really strong support system in my parents, my family, my friends, and my boyfriend, who is sharing a 500 square foot apartment with me right now, and keeping me sane and calm during my time off. I think for me, what has been most beneficial is really just picking up the phone and calling my friends and my family and my coworkers and just sharing our fears and anxieties and realizing that we're not alone. This is a shared experience with everyone, and other people are going through exactly what we are and we are going through and having a lot of similar feelings and have a lot of great advice for ways to tackle that or just to talk it out in general. So I think just staying connected has been the best way to get through this for me.
That's great. Thank you so much, Kat. Gianna, could you add your thoughts as well, please?
Yeah, hi. Thank you guys so much for having me again. So the past few months have been quite a roller coaster, I would say. From school closing in March to now, a lot has changed. Like Catherine was saying, my time at BC has really sort of inspired me to give back in any way I can. So when school closed, I had the option to just go back home to New York and come back in the fall. Responsibility, if I was trained to do this job, I should be doing it. So I managed to find my way back up to Boston to keep working. Yeah, it's definitely been weird having graduated through this time as well as working through this time emotionally. And it is hard having my family so far away, but I do have a really great support system. And I'm so grateful to have them with me, supporting me through this. So, yeah.
Well, thanks, Gianna. It strikes me you could be on multiple shows. You could have been on the show with Joy Moore. You can be on this one and probably a few more that are coming up. Thanks for sharing that. Aristotle.
Hi, thanks for having me again. So how am I? I think since the beginning of the pandemic response and our involvement as healthcare providers, it's definitely been challenging since the beginning, sort of being stripped from your routine and then having to salvage a new one while taking care of yourself and taking care of your patients. So I'm really appreciating the support that I'm getting here at home on the day-to-day from my wife and my two dogs, from my coworkers and colleagues, my family, my friends, and the community, especially the BC community. You know, while we're in this mode of giving people what they need physically or emotionally on the unit, I think it's additionally fulfilling to be able to speak with everybody on this platform and, you know, discuss what we're seeing. So I guess more immediately now I'm excited to, you know, to get into this conversation, especially. It's been our lives for, you know, the past few months. So.
Yeah, and as if you weren't asked enough, we asked you to come on the show to share your experiences with us, but we're so grateful for it. And I think that tension between caring for yourself and caring for others, that's something that some of us talked about as we prepared a bit for this show. And I think Joyce will get into that a little bit tonight. I think it will be important to talk about that tension. So thanks, Aristotle. And Andy,
you so much for having me. I think it's a loaded question. How are you? I think there's a lot of facets to it, and what I will say is, I think probably the most challenging piece of it is the uncertainty about, you know, exactly how we're approaching caring for these patients and the ways that it affects our roles being healthcare professionals, and also the uncertainty of, you know, when will this end and when can we expect life to be a little bit more normal. But I do think, like, while we're kind of waiting through that uncertainty, I have been so overwhelmed by the amount of love and support from family and friends in the community. And I think there's just really something to be said for just being held by people who understand the experience. You know, if that's nurses that we're working with who share the same experience, you know, having that level of understanding with them, and then also being held by family and friends who are sending care packages and fellow New Yorkers clapping out their windows at 7 p.m. I feel that uncertainty is okay, and we can just, you know, wade through that together because we're not doing it alone, and there's a lot of love.
that's great, Addie. Thanks. And you know, it's really our desire to understand more of your experience. You know, we of course, everything around what you're all doing is on the news 24/7, but this, I think, is going to be really helpful, maybe even therapeutic for some of us, because we're dying to understand more about what it's like for you who are on the front line. So again, we're so grateful that you joined us tonight. So with that, let me turn it over to Dr. Edmonds to ask her questions.
Thanks, Brian. To get started, I'd like to give the audience, help them learn a bit more about your work. So I'll start by asking each of you to paint a picture of what you're seeing on the front lines by telling us a little bit more about the experiences caring for COVID-19 patients. So Aristotle, I'll start with you on that. What are you seeing out there?
Yeah, so I have been working with COVID patients between two organizations since the start of the pandemic. So I was at Beth Israel Deaconess Medical Center on one of our floors that took care of some of the first diagnosed patients
Mm-hmm.
before we really had an idea of how big, our response would eventually become. Um, so, with that came changes in guidelines every day. You're checking your emails even when you're home to see what the next, practice update is going to be like. And there have been a lot of changes. So as weeks progressed, the unit that I was working on was being prepared to be like a surge ICU. So we get the
Mm-hmm.
overflow, but still the most critical patients who have breathing tubes and are heavily medicated require a lot of care. So we had to. The response from the organization was great. We redeployed a lot of our, senior RNs, expediting the licensure of our younger RNs, and training our very competent staff to take care of these patients. So everybody's learning new things every single day. And I think more recently, since I've transitioned to an intensive care unit at Mount Auburn. So now I'm taking care of mostly COVID patients in the same scenario, the most intense setting that you can pretty much be in. And overall, I think the experience. It's kind of nerve-wracking to be on the front lines with all the changes and sort of be subjected to that. But I think BC has prepared me very well and my colleagues to take care of these patients and step up, to the task at hand. We have a lot of, patients to take care of in Boston.
Can you help the audience understand when you talk about the changes? So, changes in protocol, changes in care processes, changes in personal protective equipment for you. Could you just speak a little bit more about those changes that confront you every day?
Yeah, absolutely. So initially, we were sort of figuring out just how to interact with our patients and keep our staff safe. So we have the negative pressure rooms. So we have, rooms that filter out the air in case, at that time we didn't know if COVID was an airborne illness or what form it took. So we were, putting all of these patients on the highest precautions that we could, full gowns, the tight fitting N95 respirators, goggles, the whole nine, hair nets and everything while we were walking in just to see, maybe the one or two patients that we were suspecting on our floor. And then we got this influx of, 30 to 40 patients that we had to accommodate. So, we have to adapt to that. So, that's when we started rationing, but really preserving our PPE supplies. I'm speaking mostly about my time at Beth Israel right now, but so we had to go through, what's the right way to reuse our masks or our goggles. So we were, sort of on the front lines of developing the the appropriate PPE response and striking the balance between being safe, but also being in it for the long haul.
Right. Yeah. Well, thank you. I'd love to hear and follow up more about that issue with PPE, but would love to hear from Gianna and hear about her experience right now as an EMT.
So similarly to Aristotle, my job has come with a lot of protocol changes. Again, almost daily, from starting to wear PPE for every single call because we're walking into situations where we don't know the patient's status every day. To after every call, we have to decontaminate trucks ourselves. We have to, stock everything. We're responsible for stocking our own PPE in our trucks. So there's a lot of weight on us, but also throughout Massachusetts, at least, I'm not really sure how it is in the rest of the United States. But EMS has actually been doing a large part of the testing. So I was trained to do the nasopharyngeal swab, and then the next week sent out to nursing homes to do testing on hundreds and hundreds of patients. So yeah, with this job, it's come a lot of protocol changes. It's definitely stressful, sort of managing all of that. My job is not normally like scheduled or sort of like standard every day, but this has certainly become a lot more up and down. But slowly we're getting used to it, and we're sort of finding a rhythm. And yeah, spirits are higher than they were. So.
Thank you for that. Catherine, can you tell us a little bit about your experiences with COVID-19 patients at Children's?
Yes, absolutely. So my experience is a little bit different. I actually work in a pediatric cardiac ICU at Boston Children's, which is a freestanding children's hospital, meaning that we do not take on adult patients. So our patient demographic is much different than the rest of the hospitals that in Boston and throughout the country. Luckily, our case burden has been very manageable and has remained low in comparison to the surrounding adult hospitals because COVID-19 has luckily spared a lot of pediatric patients of the severe symptoms that we're seeing in the adult population. That being said, we still have a lot of pediatric patients with comorbidities, and particularly on my floor, I care for patients with congenital and acquired heart disease, so they're particularly at risk for the severe symptoms of COVID-19. Very luckily, again, all of the patients who I have cared for who had congenital or acquired heart disease have gone on to move onto the floor and be discharged home, and really required more symptomatic management and not too much escalation of care. However, we are starting to see the emergence of the MSIS, which is a multi-system inflammatory syndrome. Mm-hmm. And those patients are being filtered, particularly to Boston Children's and some of the other large standing hospitals in the country. And what's been really remarkable is actually seeing how all of these institutions across the country and the world are coming together to share information on these patients. And it's seems like every day we're getting more and more information that's directing our care of the new emergence of this syndrome that's coming. So I think it's really cool to see the way that technology has allowed us to really collaborate internationally and start hitting this head on right away versus being on our own and seeing it and not really compiling information. So I think it's actually streamlined the identification and the treatment of these patients, and that's why we're having such successful outcomes with them already.
Thank you. Yeah, the pace of the information is really fast, and that's exciting in terms of care, but it can be a lot to keep track of. So we've heard from folks that are taking, care of adults and children in the ICUs, and from Gianna and the EMT. Addie, you are in the epicenter in New York in the ER. I'd love to hear a little bit more about your experience.
Yeah, so it's been an ongoing changing situation, but I would say to bring you back to moments of our peak back in March, I think probably the biggest change that we were seeing was that families were no longer allowed to come and accompany their patients in the ER, and that affected the way that we cared for patients in several ways. I think emotionally, it required our staff to step in as almost family figures. And that is, in the form of helping patients make decisions about whether or not they'd like breathing support or end of life care or what their goals of care are. So being partners in those decisions. Also just accompanying patients while they have very uncertain and constantly changing symptoms. So we've had to step up in those ways, which was new. And also not having family has also required, well, not just family, but so the whole goal of limiting family coming in was to limit the amount of exposure. So the impact of that on our teams too during like intubations and things like that is that we are trying to be very mindful of the people that are exposed during those high-risk procedures. So in times of intubations, there's like a very coordinated team of like a anesthesiologist, an emergency medicine resident, and a nurse. And typically those situations are all hands on deck, several people in the room, but because we're limiting exposure, our nursing staff has been called on to kind of fill in the role of taking on responsibilities of that pharmacy might otherwise do, or that respiratory might otherwise do, or that a pavilion manager who gives equipment to the room might otherwise do. So I think as a result of us trying to limit exposure, nursing staff has been called on to take on the shoes of a lot of other roles that would in other situations be in the room as supporting roles. So it's required us to step in that way as well.
Thank you. So, I mean, I'm really curious about, you know, all these changes and the limitations of putting on visitors. And I'm curious how it's working with COVID-19 patients or just working in the healthcare environment during this pandemic has really shifted your interactions with patients and families. I don't know, Aristotle, could you comment on that?
Yeah, absolutely. We've seen I think that the organizations that I've worked for have really stepped up to this need area. Patients do really well, much better in the ICU with familial support. And in both Mount Auburn and Beth Israel, we disallowed the elective surgeries and visitors since the beginning of the quarantine. So it's been months and months where these patients have been sort of in the hospital circuit. But what we've been doing is, at least at Mount Auburn, we have an iPad for every room, and we set up like video conferencing pretty much 24/7. We're there. If family members want to, whether it's talk to the medical team about decisions that are being made or the care plan, or just FaceTime with the patient. It doesn't, it makes a whole world of difference to have that sort of connection and have our patients feel supported. So we definitely, it's definitely different. I mean, we're not used to having that sort of technology and coordinating that, but I think that, I'm very pleased with sort of that that response. I think our patients are doing well with it.
So Aristotle, I'd like to jump in on that. Kind of going off of the iPad idea, we're actually using Zoom with iPads for the rooms as well. And we're using them during codes so that a room, half the room can be outside preparing medications and equipment and handing them in through the ante room without actually being inside for the code, which has actually been really great for emergent situations, since we are now taking on like 3 roles as the bedside nurse, whereas there used to be, 10, 15 people surrounding you, helping you, and hearing everything that was going on. So that's been a huge change. But I think more so what I wanted to comment on is how I think some of these restrictions have changed care and our delivery of care. In particular, in the patient population that I care for, a lot of their cardiac illness doesn't go away during a pandemic, and it's not something they can ignore. So unfortunately, I have had to have end-of-life care occur a few times during the pandemic, and obviously with the child passing away, this is devastating, but it's been even more difficult watching these families do it with just their significant other at the bedside, because of restrictions and travel restrictions and not wanting to expose grandparents and other family members to the hospital. I've watched these parents have to let go of their child with just one other person in the room, and not have the same experience of another family who's going through the same difficult situation. So I think that's just like a devastating sequelae that I can imagine is applicable to all of you guys who are caring for adult patients as well, and seeing this even more often, and just devastating watching these families have to Zoom or call on FaceTime to have to deal with a situation like that is unimaginable.
Yeah, I think that's very important. If I could just
Sure.
come back on this. I mean, the end of life scenarios are very tragic, of course. And I think just to sort of tie everything in, the technology now allows us to at least have the option to have that FaceTime or even support for the person that is at the bedside. You know, in your case, Catherine, with the you know, with a parent and a child at the bedside, and you know, having additional family members being part of that experience is, I think, you know, does tremendous you know, mitigation of grieving. I think like those last moments are valuable. So yeah, I think it's being used very effectively altogether. It seems like in your situation as well.
Thank you for that. Addie or Gianna, do you have anything to add to the conversation?
Yeah, I can add something. So in terms of EMS, we don't really get to see patients long term. But in the situations where we are called to, they're usually, like, every situation now is pretty high stress and pretty high anxiety. But in these
Sure.
situations where patients don't really know what's happening to them and their family doesn't really know what's happening to them, having to tell a family member that they're not allowed to come in the ambulance with them, that they're most likely not going to be able to visit them in the ER, adds a whole new level of anxiety, even if it isn't a call for COVID-19, particularly with like younger patients or things like that. So us as EMTs, we always have kind of taken on this role because, again, like, a lot of the situations we deal with are pretty scary for a lot of patients, and half the battle is just calming them down and making them feel safe. But we really have had to step in to a more emotional friendship kind of role, I would say. Realistically, medically, there isn't much I can do. My scope of practice is pretty limited, but a lot of times I'm just there to kind of hold their hand on the ride until they get there, which I'm happy to do. So.
Thank you. Addie?
Yeah, so I guess a story that's kind of coming to mind just listening to these is there was one night in particular. So when patients are coming in with certain symptoms, we are triaging them to an area that we have like high suspicion or low suspicion that they may be a roll-out coronavirus case. And on this particular night, I was in we call it the coronavirus bay, C bay. And on this night, we had super high acuity. Pretty much like the majority of our patients were decompensating or becoming hypoxic, not having enough oxygen. So we were going down with our airway team down the line and having to assist breathing with ET tubes. And I remember going in and preparing one patient for her intubation, and she was someone that looked just like, you know, a friend's parent or my own parent. And she was FaceTiming her family, and the family asked me, they said, can you just explain, you know, what's about to happen? And I'm the only person in the room there with her, putting her IV in, getting her all prepared in a gown, things like that. And also negotiating these conversations with family and helping educate them as to what exactly this means and what direction we're going and what our goals are. And I remember the family saying, okay, just be sure to have her give us a call once the intubation's over. And that was just such a heartbreaking moment to realize that, you know, the absence of family is not only challenging emotionally and like in terms of accompaniment, but it's also challenging in terms of kind of clearing up the air on educating families and patients on exactly the decisions that they're making and the implications of those decisions. So like I was saying earlier, I think now more than ever, as nurses, we're being called to kind of step up in different roles that we didn't necessarily expect. And in this case, kind of being an educator and helping family understand that, you know, an intubation doesn't mean that they'll be able to talk to you in an hour, but it does mean that they're going to be, you know, closely monitored and taken care of and hopefully have a better outcome with those resources. But yeah, I definitely think there's just so much to say and so many facets to the way that COVID has had an impact on the way that we're able to care for and step up for our patients.
Yeah, and something I'm really hearing like from all of you is this, I don't know if it's the role change, but the expanded role that you have in your jobs, in terms of because of the composition of the team has changed, or for the purposes of infection control. You're really being asked to do a range of services and tasks for the good of the patient. And so I think I'm just going to, jump in, and I just want to you to reflect a little bit about your undergraduate education at BC, and given these challenges with these shifting roles, with these changing protocols, with the fear, with the uncertainty. Maybe you could just tell us a little bit about how BC prepared you to meet the challenges of this pandemic, either professionally or personally. Catherine, would you like to start us off on this one? And feel free to jump in and share.
So I think while I was an undergraduate student at BC, we learned a lot about marginalized populations and how we could identify them. And I know that you and I and Addie had actually spoken about this when we were on the phone with Brian, meeting people where they're at, not where you want them to be at. And that's sort of something that we were always taught in our undergrad nursing education to think about. And now it's even more important because all of these patients are coming from different backgrounds. And I know something that was really important was to reflect on how their different disparities might impact them during this. And so I think my education at BC has made me really think about how maybe their socioeconomic status or their race might impact this experience for them differently than if it were happening to me or my child or my parent. And that's something that I've really noticed, is that some of these lower socioeconomic families are really struggling, whether they are out of a job or they don't have the option to work remotely. Some of them are single parents, and they're dealing with a lot of the same stressors that everyone's feeling, trying to homeschool 4 other kids at home, or juggle working. All of these, they're dealing with the same stressors but in a different capacity, and with less resources. And I've noticed a lot of people who relied on friends in the community or family for rides just to get to the hospital to see their child, or to watch their kid after school, or these after school programs that were absolutely necessary to them to even fulfill their job at baseline. And all of those resources are gone now, and they're faced with a very difficult decision of, do I stay at home with my well children, or do I come to the hospital to be at the bedside with my child who's sick? And that's really a decision that no parent should have to face. And then they're doing it on top of the burden of wondering if they're going to have a paycheck and wondering how they're going to just fulfill their baseline duties. So that's something that I've really reflected on. And I think that my BC education gave me that insight to think about those things when I'm caring for these patients and families.
Yeah, I'd actually love to jump in on that too. I definitely echo a lot of what you're saying, Catherine. I think, the ability to quarantine and social distance is really a privilege. And I think, having come from an education like BC, I am even more motivated to look at patients not as just like their health issue, but also who they are as a person and what their life looks like and what decisions and possibilities make sense for them. And I know a specific example of a challenge we were having with a lot of our emergency room patients in New York City was when we received patients experiencing homelessness who we had suspicion for COVID, and they were well enough to be discharged. Many people in that situation, if they were well enough to be discharged with COVID-like symptoms, we recommended going home to self-quarantine and just, comfort measures and come back if you need further care. But for those patients experiencing homelessness or, housing insecurity, it was a real challenge to be able to, you can't tell someone that same suggestion of go home and self-quarantine. We had a really big issue there. And I think being someone, educated from a place like BC, where I was really encouraged to look at people for their whole life and situation in person, I was really motivated actually to collaborate with like social work and a couple of our other resources at the hospital to figure out what a reasonable solution for these kinds of patients would be. And actually, after a few conversations and seeing this recurring pattern of not giving a fair option to people in that situation, we were able to develop and put together some resources in the hospital to be able to help people in that situation have a ride home with a lift that was not on a subway with a ton of other people, and also free stay at a hotel, where we could actually give them an option that worked for them and that they would have that same ability that someone else would have to, go home and quarantine and stay safe for themselves. And not only for themselves, but also a lot of these folks would be living with siblings, and they would be trying to go back to their shelter where they were roommates with their siblings and elderly parents. And, it's just not fair or right. So I think coming from a place like BC, motivated me to try and tackle those issues more holistically.
Thank you. I think I can speak for the Cannell School of Nursing faculty and the emphasis on social determinants of health, and just hearing you speak about your patients in that context. I have to say I feel very proud, and your patients are lucky to have you as nurses working with them. So thank you for that. Brian, are we going to switch and move towards audience questions?
Yeah, we have some questions coming in from the audience, and maybe I'll ask the first one.
Sure.
We have a question from Cameron Hicks from the Carroll School of Management, class of 2018. So the question is posed to everyone. What has your experience been with PPE rationing at your respective institutions? That's something we talked about preparing for this, where the textbook's almost thrown out the window on this one. So it'll be interesting to hear what you have to say there. Maybe some follow-ups from Cameron as well, if folks want to tackle these. What do you see as the biggest hurdles to equitably rationing PPE across the country? How do you think the fatal effects of limited PPE supply could have been mitigated? Anyone want to start answering that question? I think this will be a group effort. Kat, why don't you start us off?
So I'll tackle just the first part, which is what has your experience, or what has my experience been with PPE rationing? We kind of joked about this when we were talking earlier this week, but it's almost become the new norm now. So I actually find it normal that I recycle my N95. And in Boston, most of my fellow colleagues at the other hospitals are doing very similar practices, where we actually bring back our PPE at the end of the shift, and it goes through, I believe, a UV program in which it's disinfected that way and brought back to us for 5 or 6 more uses, unless it's visibly soiled, and then we are to throw it out. That being said, I'm far more fortunate than I think a lot of other people have been internationally in terms of having access to adequate PPE. While there has been shortages, I have always felt very well supported by my institution, even if these practices are reusing the PPE and the textbook is out the window in terms of one-time only mask use. However, I do feel as if I've been in a very fortunate situation, again, where I have had a gown every time I needed a gown, and a mask and a shield, even if I am reusing them and cleaning them myself.
Gianna, did you want to?
Yeah, so similarly to what Catherine was saying, we also have to reuse all of our PPE and EMS. So we were all fitted for an N95 way back in February or March, like in anticipation of this. And from there, we were told to sort of keep it as part of our uniform from there forward. And we reuse it until it's visibly soiled, in which case it goes into a bin for disinfection. But yeah, so all of our PPE is kind of, I don't want to say locked away, but we would have to request it if we needed extra to stock our truck. But again, like Catherine was saying, I think that where I work, at least, I know this isn't the case everywhere, but I feel really supported where I work. And I feel like they were really adequately prepared for this in terms of making sure that all of their staff is safe. They keep emphasizing that like our safety is their number one priority, which is really, really like heartening to hear and reassuring during this time. So yeah, I do feel like I'm very lucky in terms of that.
So to build on what Gianna was saying, sort of in terms of the PPE that we've been using in our adult settings in Boston, I see now that we're sort of expanding like approval for different companies and different fits of, say, masks. So we are, exploring whether it's safe to use, a silicone mask with additional filters on them, or a KN95. So we're doing a lot of vetting across different companies to get just to expand what we can use in terms of our PPE resources, on top of the reusing, recycling, and disinfecting that seems to be pretty ubiquitous in healthcare right now. So I think that's been able to mitigate some of the shortages on our units. We just I think we're expanding our options and allowing exactly that we're going to have more options.
Yeah. We have another question that's come in from Maura Early, an SDM alumni, and she's comments that you all seem very supported and calm during your work. And the question goes out, have you had any moments of panic, especially internal panic, while doing your jobs under these tough circumstances, and how did you cope? And then Father Keenan, kind of as a follow-up to that, really wants to know what has been one of your best moments the past 2 months. So I don't know, Addie, if you could start to respond to that.
Certainly had those moments of panic. And yeah, I mean, for me, honestly, they happen almost at like sneaky times where something mundane is happening and I just feel like overwhelmed. But I will say that, like, despite having an ever-changing approach to treating these patients and sometimes not being sure of like exactly what the best thing to do for a patient is, or despite not knowing when this will be over, or despite even just like, you missed the last bus and you were trying to get home and you're tired and you just want to be home in your bed. And there's just moments where, it can feel lonely and you can feel like you want to see your family and you just would love for this to be over. But I think in those moments of panic and in those moments of like being just sad for the world, I have been totally rebounded by people who just like show up with a cup of coffee and just drop it at my door and say, if you need anything, let me know. Or a FaceTime or a Zoom call with a friend that I've kind of lost touch with or haven't, made as much of a point to connect with, and they reach out of nowhere because they have this newfound time to be able to check in on friends. And I think, again, a gift BC has given me is through like a lot of different immersion and different experiences is, the knowledge that like staying where it is hard to be sometimes is okay. And like, if you have people to navigate that with, like, it's going to be okay. And you just take it one day at a time. So yeah, there have been moments, but there have also been better people and better moments that keep me going.
So we have another question. This is switching topics a little bit from Quasi Sarkoti Mensa from the Boston College Libraries. Quasi asks, we are just beginning to welcome the class of 2024. I'm sure all of our incoming nursing students have COVID-19 on their minds. What advice would you give to them? How should they prepare themselves as they venture into the unknown and start their experience at Boston College?
So I think I have a pretty appropriate response for this. So just to speak on my experience as an undergraduate at BC, I think this also circles into a previous question that we were discussing. I came into BC as really as sort of a self-driven, competitive. BC is a great school to, so you have to sort of try to muscle your way into admission. So very sort of that, competitive nature. But after 4 years at BC, just being in the environment and being exposed to that, holistic practice directly translates to how we deliver patient care. I mean, the selflessness that I've sort of cultivated over the previous 4 years that I've been at BC has, done wonders for my practice in nursing. So I think that for incoming students, it's important to just have faith in the process. You will be developed into a competent, confident nurse, and we all thank you in advance for what you're doing. But you kind of have to submit to be men and women for others, because that's truly what I think it comes down to. And as long as the passion is there, I'm sure that all of our new graduates will have plenty of success in the field.
Thank you, Aristotle. We have another question from Patty Joyce, who works in the MCAS Dean's office. And she asked, my son is an EMT in New York City, Queens. He has a new baby, 8 months old. And she'd like to know how you all deal with working the front lines and then coming home to your loved ones. Thoughts that you'd like to share on that, Catherine?
So I think having a routine and a plan is what has worked best for us. And like I'm sure many of you have heard stories online in the newspaper, my routine is giving him my boyfriend a phone call before I am getting upstairs to the apartment. And it means this nice routine where he has to turn on the shower, the laundry room is open, and I just immediately run straight to the shower and then on sanitize two times through. His family actually has also been working in grocery stores, and I've heard a lot of similar stories from his brother, who has to do a lot of the same, like just have this routine outside the house, try to get as much off before you get in the house, and keeping his wife, who was pregnant during COVID-19, safe from all of this. So I think it's possible, it can be done. And it's scary, but I think you just need to stick to a regimen, come up with it beforehand, and you just really can't falter from that. But I also think it's really important to stay with your family if that's an option, if you find a way that you can keep them and yourself safe.
It sounds like the support of your family and friends is essential to all of you right now. So Gianna, did you have anything to add to that?
Yeah, so I'm in kind of a different situation because I'm living alone currently. But it has definitely been hard not being able to go home and really see my family. Even if I wanted to go home for a weekend, there has been a lot of fear almost to be like, are you sure that's safe? And then I have to rethink, and maybe it isn't the best option. I know particularly one thing that has been on my mind is my grandmother. She lives alone in upstate New York, and was planning on moving in with my parents this spring. But all of that has kind of been put on hold because we were home from college for a few weeks. They didn't really think it was safe for her to be around us. So just kind of like hearing her, as well as a lot of my elderly patients who are, in nursing homes who aren't allowed to have visitors, like my thoughts are always with them in terms of not being able to see family.
Thank you. I'm aware of time, and Brian, I thought I would just pose, one last question for the group, and just, a broad one. What else would you like the audience to know? Perhaps something we haven't covered yet, or something you'd like to emphasize. Is there anything else that you'd like the BC audience who's listening tonight to know?
Yeah, I think just very quickly, something that is highly relevant now is reopening and transitioning back into our new normal. So I initially was very hopeful when everybody sort of subscribed to the, wearing face masks in public and socially distancing and restricting the number of people in their gatherings. But as we approach, this, reintroducing to society, it is something that we still need to keep in mind and hold very important. I think at Mount Auburn, we're already seeing an influx. I hesitate to call it a second wave, but I mean, it's going to continue to be a long, a marathon. So it's important that everybody else can support us as well by, staying steadfast with, the ways that they're protecting themselves and in their community. So.
Absolutely. Addie?
Yeah, I think something I definitely want to put on the table is like a concern for mental health of just like the world and healthcare workers going forward in the coming months. I think there's kind of like a novelty to this for the first few months, and everyone was kind of on the ship, ready to do it, take it on. And now we're kind of like in this phase of like going on months and like, okay, how is my life going to look over the course of the next couple of months, the next year, the next couple of years? And I think, even working in the emergency room, not only do we see COVID patients, but we see all patients, and we have a whole section for psych. And unfortunately, like a few of our traumas too have been a result of, mental health challenges. So I just have a real concern for that. And I just encourage everyone to just continue being present to their loved ones, and to just, check in on people who maybe you don't even have a concern for, but just, I think people just do better knowing that they have a circle around them, and that they're loved, and that someone's checking in on them and thinking of them. So that goes for everyone. I just think that is just as important as our concerns about COVID.
Thank you, Addie. The humanity and showing that at this time. So thank you all so much. I'm going to turn it over to Brian.
Yeah, thank you. I want to thank you all, Addie, Aristotle, Gianna, Kat, and Professor Edmonds for leading us through a very stimulating conversation into your worlds. Gianna, you're a special EMT and a special MCAS grad. I was joking with the Canal School students when we were preparing for this. I've attended the last 10 commencements at Boston College, and I will attend the one for the class of 2020 when we celebrate in the fall, hopefully. But something I noted was there's something special about when Dean Gennaro asked the Canal students to rise to accept their graduation. And I was always struck by how the Canal students, they rise with such animation and joy and noise, but it's really a communal kind of celebration where, you're embracing one another, and there's really a sense of camaraderie among the Canal students. And I know Joyce feels this as well because we talked about this, but there's something special about the Canal School of Nursing. There's something special about the ways in which we're teaching all of our students across the schools about entering the healthcare profession. And you truly embody that. And we're so grateful for you. As I said in the beginning, I think you embody the common good. And if we could all act more like you, I think the world would be a much better place. Thank you very much for joining us. Before we end, I would like to preview the next segment of the show at 6, which will take place on May 29th from 6 to 7 p.m. The next show will be called Physicians and Medical Assistants Treating COVID-19 Patients. It'll feature Kathleen Barnes of the class of 2007, MD, Scott Jelnick from the class of 2010, an MD, and Emily Zona, a recent grad from 2019. That show will be hosted by Drs. Thomas Childs, who's the Vice Provost for Research and Academic Planning, and DeLuca Chair of the Department of Biology, and Danielle Tagan, the Associate Professor of the Practice and Chair of the Faculty Pre-Health Advising Committee at Boston College. Now, if you want to join that conversation, please remember that you need to register for that segment. You have to register for each one that you would like to attend. Registration doesn't take more than a second, but each segment has a different webinar link. So please check out our website, bc.edu/show@6, and see the topics for all of the segments that are coming up. And with that, let me please just say, be well and stay safe. God bless you all, and good night from Boston College.